Dr. Vidal. This is our weekly check-in. We discuss different topics in plastic surgery and I get to answer your questions. Today we're going to talk about a very popular topic and cause of a lot of questions, and it's about foams, boards, and FAJAS. So whenever we do body contouring procedures, the compression is key to have that skin retract and the swelling to calm down. And all those things, FAJAS, foams, boards, just help with that. But I had a friend once told me, it seems I have to do like an extra bachelor and extra studies to understand all of these little things, like what stage 1, stage 2, foam, FAJA, board, whatever, what's the order. So let's talk a little bit about each of them and what's the purpose, why we use it. And if you understand the purpose of each one, then it's going to be a little easier to know where to put it and how long and so on and so forth, okay? So let's start with FAJAS. FAJAS are going to be extremely important in liposuction cases and other body contouring procedures like tummy tucks, circumferential body lifts, neck procedures, arm procedures, anything that requires like contouring or removing excess skin, it's going to require a FAJA, because the FAJA at first is going to aid on decreasing the swelling, and then it's going to help on the contouring. So the FAJAs and the compression garments are essential in any body contouring procedure to achieve a good result. But what is this about stage 1 and stage 2? Well, stage 1, it's a FAJA that the garment itself, the fabric, is not as thick. Why? Because at first the skin has been traumatized, and when you traumatize the skin with liposuction, with cutting procedures like a tummy tuck, you are at risk of skin necrosis because the blood supply to the skin has been traumatized either with a cannula or cutting it with a tummy tuck, okay? So you want to put pressure to help with the swelling, but you don't want to strangle more the tissue and create more blood supply issues that can lead to lipoburns or skin necrosis, okay? So the stage 1, and I have an example of a stage 1 that we use here at Pure. They come in different colors, different shapes. This one is the classic one that we use for Lipo 360 BBL procedures. It's good because it goes up to the axilla. Remember that when we're doing liposuction, Lipo 360, the liposuction on the back goes all the way up here. So you want a garment that also compresses this area here, okay? Garments that end here, it's not gonna adequately compress the upper back just below the axilla. So these garments are good because it reaches all the way to the upper back and gives good compression around the axilla, okay? But the fabric itself, it's not super thick, and it gives, okay? It gives you that leeway so the skin can swell without causing skin necrosis and too much compression, okay? How long? 7 to 10 days. 7 to 10 days is enough for the blood supply to redistribute and the skin to start healing. So then we can switch to the stage 2. Stage 2, I have a male version of a FAJA for stage 2 here. So it's a little bit bigger. But what I want you to see is the fabric. The fabric is thicker. It usually sits in the front, in the middle, and usually in the female versions, let me see if this one has it. No. In the female versions, it has 3 different clips. Why? Because you're going to notice that with time, you're going to be decreasing in swelling, which is decreasing in your waist and your hips and everywhere. But when you have those 3 clips, you're going to start on the wider or bigger one, and subsequently, once the swelling starts to come down, you're going to be tightening more and more. And the fabric itself is thicker, which helps with the compression and contouring, because at that point you want a thicker garment that can give you that contour and that snatched waist and give you that better look, okay? So again, this one is a male, so that's why it looks bigger, but I just wanted you to see the fabric type, okay? So that's the difference between stage 1 and stage 2, okay? Stage 1 for the first 7 to 10 days, basically helping with the initial swelling to avoid massive extension swelling, but not putting too much pressure or tension in the skin so it heals. And then you switch to a stage 2. Stage 2 you're going to use for the first 6 weeks until 6 weeks post-op for 23 hours a day. What does that mean? You're going to be wearing it day and night. You're just going to remove it for shower and for massages, okay? So that's for the first 6 weeks. Then you add 6 weeks, you then go down to 12 hours a day. So when to remove it, day or night, it doesn't matter, as long as you use it for 12 hours a day. There's some patients that are tired of wearing it during the day and want to rest during the day. That's fine, then use it at night. But there are others that want to be more comfortable when sleeping, then use it during the day, okay? At 3 months, what happens? So at 3 months, most of the post-operative swelling has been gone. So the contouring and that initial period post-surgery is done. So you can toss the faja away. There are a lot of patients that at that point they're scared or they feel more comfortable with the faja and the compression garment. That's okay too. So at that point is a personal choice if you wish to continue the faja or stop it. There's not going to be any affecting the surgical result at 3 months. It's more of a lifestyle decision. If you wish, there are people that live with a faja because they feel more comfortable, they look more, they like more their shape, and that's again a personal choice. Surgical wise and surgical results wise, up to 3 months. At 3 months is completely up to you. Okay. So that's stage 1 and stage 2. I have 2 different other garments that I wanted to show you. Sorry that I'm off the screen. One is the face, the neck one, okay? So this is the one that you're gonna use for the neck, okay? It brushes in front, in the neck area here with a Velcro, okay? That compresses the chin area and then it wraps around the head, okay? So it looks like this little diagram, okay? So you wrap it around the head and in front in the neck to give compression to the neck. This one is obviously very hard to disguise when going outside. So I ask you to wear it if you're having liposuction to the neck at least for 2 weeks at all times. After 2 weeks, as much as you can for the first 6 weeks. So from 2 weeks to 6 weeks, at least 12 hours a day. So when you're home, wear it. But if you're working from home, for example, and you can wear it longer, then even better, okay? I know that going outside with this is not very pleasant. So that's okay after 2 weeks to remove it if you're going outside. But if you're staying home, try to wear it, okay? Until 6 weeks out. That's the face garment. And the other one is the arm. So if you're having arm liposuction or a brachioplasty, this is the extension for the compression to the arms. It goes up to the elbow and gives you good compression. I don't use it for the first 7 to 10 days. So that initial period that you're used to stage 1, you're going to be using an elastic wrap, okay? And then when you switch to a stage 2, that's when you switch to your arm garment. There are some stage 2 fajas that come with the arm garment included. If that's something that you prefer, then you can choose to buy one of those. But here, because we have on and on the garment, sometimes added arms or not, we have it separately. And if you wish to use it separately, you can too. The important thing is you have the compression up to the elbow, okay? That's with the garments. Let's go to the binder. So if you're having a tummy tuck, you're not going to be able to wear a faja until the drains are out. Why? Because you're going to have 2 drains coming out and you can't really wear the faja, okay? So the binder is this, okay? It's like a wraparound that you're going to put in your torso, and this has a Velcro here, and you're going to Velcro it, okay? Important thing is that, remember that I mentioned before the blood supply. The blood supply to the tummy tuck is very important. You can have skin necrosis if you put too much tension, okay? So the binder is to have good compression, that you wrap it around, that gives you compression, but you shouldn't be strangling yourself like this. That's too much tension. And that is, if you can't breathe, that's not good, okay? If you can't breathe, your skin is not going to get blood supply, okay? So enough that you have good compression, but you can easily kind of breathe and it's tight, but not go crazy on the compression, because then you can have skin necrosis in the skin, okay? So you're going to use this again for the first a few weeks. The drains are usually in 2 to 3 weeks, depending on how much the drainage is. Once the drains are out, then you go to the faja. Which one? So remember, the stage 1 is for the first 7 to 10 days. And you're gonna have the drains for 2 to 3 weeks. So when the drains are out, then you can go to stage 2, okay? You can go to stage 2 garment at that point, okay? And same, you're gonna use it the same period of time like a liposuction, okay? 6 weeks at all times, and then from 6 weeks to 3 months, 12 hours a day, okay? Foams. What are the foams? So this is an example of the foams that we're gonna give you. Foams, and you can see they're soft, okay? It's not a board. The board is the hard one, okay? The foam is soft, and this is to protect your skin, okay? So this is what goes directly over your skin, and then the faja, okay? Or the binder, depending on if you're having a tummy tuck or a liposuction, okay? So this, what it does is helps with decreasing the swelling and protecting your skin, okay? Why? The fajas, the binders can create creases in your skin. And long term, not 24 hours. I'm talking about long term. If you wear it for the 6 weeks, that faja creating that crease in a certain position, then that can become permanent, okay? So that's why the foams are so important, okay? Especially those first few weeks. This you're gonna use for the first 6 weeks. You're gonna start using it post-op day 1, okay? So when you wake up from surgery, you're not gonna have them on, but the next day, on your first day post-op, after your first massage, after that, then you start wearing the foams. And then foams day and night with your faja until 6 weeks out, okay? How do you put your foams? Depends on how long is your torso, okay? With liposuction 360, we're gonna give you 3 foams, okay? 1 to put in the center, and then 1 on each side, okay? Usually with the average length of the torso, you're gonna put the 1 in the middle, long-wise like this, okay? From here to here, and that gives you good compression in the upper abdomen and also the pelvic area. The swelling tends to migrate down with gravity and build up in the lower part, okay? So that's why this in the lengthwise is important. If you put it like this, the pelvic area is not covered with the foam and you're gonna get a lot of swelling down there, okay? So like this, lengthwise, here, okay? The other 2 you put sideways, okay? 1 on each side, okay? 1 here and 1 here, okay? Very, very important that when you're putting the 1 on the side that is in close contact with the 1 in the middle. If you leave a gap in between the foams, basically you can see my shirt, that happens. Swelling kind of creeps up and you're gonna get swelling, like bands of swelling in between. Again, if this happens once, 24 hours, and you fix it the next day, that's fine. But if you don't fix it and you keep it like that for 6 weeks, at the end, you may have creases forming in those areas. I have a good video that you can check on my Instagram page that shows a patient that had it placed a little bit far apart, and I show that area that's accumulating the swelling, okay? So foams, super important, 6 weeks at all times, okay? There are some foams that are 360 that are easier to put, because you'll see when you're putting the faja, sometimes it's hard to kind of get all the foams in place and put them together that they're don't have a gap and then they cover all the areas. So there's ones that's 360 and you kind of wrap like the binder and then put the faja. Just be careful, because sometimes when you put the faja, then that 360 kind of migrates up and then you don't have good compression in the lower pelvic area, okay? So if you do, just try to make sure that when you're putting the faja up, this doesn't rise up and you end up like this, okay? So that's with the foams. Boards. So boards are a hard device. I don't have an abdominal board, unfortunately. I have the little triangle board that we give you here, but you can see it has a hard portion, okay? The foam is completely soft. The board, it's a board. It's a hard component. Why? Why put a board? The board is going to give you stability, okay? Whenever we sit, our skin creases. That's completely normal. Even if you are, in a pro athlete with a six-pack, if you sit and scrunch over, they're gonna have creases in the skin, okay? That happens to everyone because there's skin that needs to be in excess so we can stretch out and collapse, okay? That is just our body. So the board, when it creates stability over the foam, so when you sit, those creases don't kind of bend in and get faja and may become permanent. So that helps with the skin redraping and getting it as flat as possible. So when you sit, because the board is hard, it's keeping you from going like this. It'll create a stability on your torso so the skin retracts evenly, okay? So patients with skin laxity and patients with creases, when they take the faja out and stuff, it's a good alternative. This one is good for BBLs to try to create that that triangle in the upper buttock where most of the swelling builds up and creates that curve in the lower back to upper buttock area. So this one is good for that area. And the abdominal board, it looks pretty much like this, but a big one to put in the entire abdomen. First the foam, because the foam is to protect your skin, then the board to give stability, and then your faja, okay? When do you start using the ab boards or the boards hard stuff? After your stage 1, okay? So stage 1, remember stage 1, we want to protect your skin. After those first week, 7 to 10 days, that we switch to stage 2, that's when we kind of go to the contouring part. We put everything like the thicker garment, you can put the board, you can put more pressure, okay? So boards with stage 2. When you're talking about tummy tuck, it's better to wait for the board when you switch to a faja, okay? So same, with stage 2, you can add the board, okay? Definitely with the tummy tuck, not before 2 weeks, okay? You don't want to put any pressure on the incisions the first 2 weeks because they may open up, okay? So wait at least with the stage 2, which is usually 2 to 3 weeks out, okay? The BBL pillow, I wanted to show you a good one. The BBL pillow, it's gonna be used obviously after a fat transfer to the buttock and hip. You shouldn't be sitting in your buttock in the fat grafted areas the first 6 weeks. Why? That fat that it's transferred to the buttock survives from the fat around it. If you put pressure, there are no blood vessels there still. They're kind of growing. It's like the new plant growing roots. So those roots need to grow for the first 6 weeks. If you put pressure before, those roots don't have any oxygen and the fat dies, okay? So the BBL pillow, you can start using it 2 weeks after surgery. And basically, it's important that you choose a pillow that's hard, okay? It shouldn't be a comfortable, fluffy pillow, because if it's a fluffy pillow, then when you sit, it's gonna squish and you're gonna be sitting in your buttock, okay? It needs to be a hard one, like this one. And then you see this is where your thighs go. So basically when you're sitting like this, and there is no pressure on the buttock or hip area, okay? The donuts or the whoopee pillows, those tend to put pressure on the hips. So that's why I like one of these type that it's not a circle. So when you sit, there's nothing in your buttock and hip area, nothing touching, just your hips, okay? Try to start it 2 weeks after surgery and up to 6 weeks, because that at 6 weeks is when you can start sitting down, okay? I'll take some questions now.
We have a lot.
Right here.
¿Cuánto tiempo se debe esperar para viajar after breast reduction?
So, después de una reducción de senos, debes por lo menos esperar 5 días, ¿ok? Recuerda que te vas a tener una cita conmigo aquí en la oficina al 5º día postoperatorio. Depende de cuándo te operes, porque sábado y domingo estamos cerrados en la oficina, así que tienes que siempre verificar, dependiendo de tu día de cirugía, cuándo cae ese día 5º postoperatorio. Si cae fin de semana, te voy a ver ese próximo lunes. Una vez yo te vea y esté todo bien, ya te puedes regresar a casa.
Where can I get that BBL pillow?
That BBL pillow, that's a good question. So most of the faja stores sell those BBL pillows, even Amazon. Just check on the reviews so you can see the fabric and make sure it's a hard one.
Okay. When are you cleared to return to this job after a mommy makeover? Also, when can you lift a baby about 17 pounds?
Okay, so the first question, returning to work, depends on what you do if it's only desk.
Yes, says desk.
So desk, you should be okay to go back in 2 to 3 weeks. Remember that at 2 weeks you may still have drains. So if you're uncomfortable leaving your house with drains, then wait until 3 weeks. By 3 weeks, the drains will be removed, and then you can definitely go back to desk work. 2 to 3 depends on your comfortable level with the drains. The second question was lifting. So you have a 10-pound limit restriction on heavy lifting. So 17 pounds, not until 6 weeks out.
Okay, this is about the faja. I'm 13 days post-op and live alone, so although I was fitted for a stage 2 faja and had help getting it closed, I can close it at all by myself.
Yeah.
Is it okay to still wear my stage 1 with foams?
So I think the best option would be to get a stage 2 that's a little bit bigger. Okay, sometimes the FAJAS stores want to sell you a very, very tight garment, but you still need to fit the foams, okay? And at 13 days post-op, you need the extra compression that the stage 1 is not going to give you, okay? So the best option would be to get a stage 2 that's a little bit bigger, or some FAJAS stores sell an extension of the clips, okay? So you can buy those extensions, and it's probably going to be just a few days, and you will get to an easier closing of the faja, but those extensions can help you close it in the few days in between that you still are swollen.
This is a really good question.
Okay, I'm excited.
Cuando uno se hace un BBL, ¿no puede viajar en avión?
So, la respuesta es sí, pero tienes que esperar por lo menos 5 días postoperatorio que te veo en la oficina. Cuando yo te veo en la oficina, te remuevo el drenaje y ya ahí puedes viajar de vuelta, pero tienes que usar el BBL pillow, ¿ok? En el avión te vas a tener que sentar, no te puedes estar de rodillas para el despegue y aterrizaje por motivos de seguridad, y pues vas a tener que tener una almohadita de estas para que te puedas sentar.
Okay. Después de 5 meses de operada, drenar con aguja, tummy tuck, ¿se puede?
Drenar con aguja, depende, o sea, eso me imagino que tienes un seroma. Si tienes un seroma 5 meses postoperatorio, deberías contactar a tu cirujano. Si soy yo, por favor, me dejas saber. ¿Por qué? Porque 5 meses postoperatorio ya no deberías estar requiriendo drenajes. Los drenajes por aguja usualmente son los primeros meses, 1 o 2 meses. Luego de eso ya debería haber resuelto. Así que si todavía te está viendo eso, pues hay que indagar un poquito más en qué es lo que está pasando.
I had a blood clot because of birth control and a 10-hour flight. Can I still get lipo?
Unfortunately, I don't perform surgery in patients that had prior history of blood clots. The reason for that is, like you mentioned, your risk of blood clots is higher, and anything that increases that risk a little bit, like a long flight, like birth control, then predisposes you to blood clots. The problem with surgery is you're probably traveling, you are getting general anesthesia, and then you won't be able to move a lot because of the surgery. Those are 3. With a major blood clot, and pulmonary embolism can be deadly, okay? So I don't think it's worth having that risk with a person that has prior risk of blood clots.
¿Hace rinoplastias?
Seguro que sí. Hago rinoplastias. Las más comunes son que las personas quieren mejorar el tabique o la parte del dorso de la nariz, o refinar la punta. Esas son las más comunes. Pero si estás interesado, la manera más fácil es yendo al website. Hay una forma que es de consulta virtual. Tú llenas esa información, me envías fotos y yo te dejo saber si eres candidata o candidata y qué podemos hacer para ayudarte.
Will there be an issue flying on a plane home after a tummy tuck?
So, I mean, as long as you are walking every hour, and when you come for a tummy tuck, I'm going to give you what's called the sequential compression device. So that is a kind of sock or wraparound that you're going to put in your calves, and that massages your calves. That promotes circulation and decreases risk of blood clots. So that you need to charge because it's battery operated, and take in the plane with you to wear it. And also be hydrated. If you meet all those requirements, you should be okay. to travel. Awesome, guys. So thank you so much for the questions. I hope this kind of helped answer most of the questions regarding phones, faja, boards, when, how, and all of those questions. If you do have any questions, you can always DM me or register through Clara, and we'll be more than happy to answer your questions. And I'll see you guys next week. And tomorrow, mañana, tenemos live con Gisela TV en Instagram. Va a estar en mi Instagram también. Vamos a estar hablando, ya tiene creo que casi 2 meses postoperatoria, 6 semanas. 6 semanas postoperatoria. Así que la mayoría de sus incisiones ya están sanas, la inflamación ha bajado muchísimo y vamos a hablar de su recuperación y contestar todas sus preguntas. So, I'll see you guys tomorrow if you want to join at 9 p.m., 9 de la noche en mi Instagram, live con Gisela. Y si no, también el martes que viene Tuesday Tips. Nos vemos.